You had come to see me some time ago, and we did some testing and found that you had, as part of the background to your medical problems and concerns, an issue with your immune system not producing enough antibodies to keep you free of infections. Can you talk a little bit about your infections and what happened when you got on this IgG therapy?
Well, the nurse educator and me, I decided to look back over my history prior to starting IgG therapy. And I actually did a table. And I really had been unaware of how many infections I had had over like a 2-year period. And so, I mean, and it ran the gamut from, UTIs. I'd gone to the urologist. I had, the one that stands out for me is an infection I had in a finger. My finger just was so swollen that I had to go on antibiotics again. So how many times does somebody get something under their nails, their body takes care of it, with whatever openings there. So I had this long list of infections that I was just, I treat. Oh, got a UTI, let's go treat it. Oh, got a URI, let's go treat it. Oh, sinusitis, let's go treat it. And after I started the IgG therapy, the infections went away.
No more infections, no more antibiotic therapy for infections?
I can't even think of when, other than this recent bout when I had chemo and got, had neutropenia. Other than that, I can't even think of a run of antibiotics that I've had.
And did you have a lot of sinus infections during your life?
In general, yes. I was prone to sinus infections, had allergies.
So you would get a sinus infection, go to a doctor, and their approach would be to prescribe an antibiotic. Is that how it would happen?
Yeah, sure, absolutely.
And this was a condition that kept recurring?
Well, yes, the infection, the sinusitis continued, but as I say, all these other small, fortunately, minor infections, and I just run somewhere, run to urgent care, go to my primary, I had a drop-in service, come to the ENT. I went and treated the urologist, had to work up there, because I seemed like my UTIs were increasing in frequency, which I hadn't had since I was in my 20s and had a special procedure done. So it clearly, it was such an obvious difference in my infection, or lack thereof, once I got on the IgG. And that for me was just like, here's the evidence. It's anecdotal, but it's clear.
Right, so you found that by addressing the underlying problem with your urinary tract infections, with your sinus infections, with your other soft tissue finger infections, wasn't enough to keep them from coming back or recurring. Instead, that pattern of illness explained the underlying problem with your immune system, once corrected, no longer having these infections.
Absolutely. And for me, that's, like I say, that's the evidence. If you saw my table, which I brought, if you see my table of infections, how I was treated, what I was treated with, I did the whole thing. When it occurred, what it was, who treated it, what they treated it with, and it wasn't until I got tested for my IgG levels to find out that they were below normal and started doing the replacement therapy that the infections, it was like poof, miracle, went away.
Well, thank you very much for speaking with me.
You're quite welcome. I would like to share my story with others.